Welcome to the World Massage Conference.
Hello and welcome to the World Massage Conference. I'm your host, Melanie Hayden, along with my co-host for this presentation, Kevin Cunningham. And this presentation is going to be with Diana Thompson, and Diana is going to be talking about record keeping for massage therapy. I want to thank our global sponsor, Massage Envy. And Massage Envy is the leading employer of massage therapists in the United States. To discover the benefits of choosing Massage Envy as your career, visit their website at massageenvycareers.com. I also want to thank all of our daily sponsors who help to make the World Massage Conference possible. That's Massage Today. Massage Today is the news source for massage and spa therapy communities. Subscribe to the Massage Today News Update free e-newsletter at massagetoday.com. And Massage Warehouse. Massage Warehouse provides massage therapists and related industry professionals with the largest selection of quality products at a great value. Visit their website at massagewarehouse.com. And the Upledger Institute. The Upledger Institute, founded by John E. Upledger, leads the world in light touch therapy training programs, information, and products. You'll find them at upledger.com. Massage Magazine is also a daily sponsor, and Massage Magazine Insurance Plus. Please visit them online at massagemagins.com for the best value in massage liability insurance. And BioFreeze. BioFreeze is pain relief that works. To learn more about BioFreeze, ProSage, and the TheraBand family of products, visit them at biofreeze.com and therabandacademy.com. Record keeping for massage therapy. Increasingly, massage therapy is viewed as a healthcare modality, both by legislation and by consumers. As healthcare providers, massage therapists are expected to chart all patient visits, regardless of the type of therapy provided. That said, wellness sessions and curative sessions require different styles of charting. In this presentation, you'll learn how to document all patient sessions, including a variety of record-keeping styles, to meet the specific needs of your individual massage sessions, including SOAP, functional outcome reporting, and wellness charting. This presentation is perfect for massage educators, students, and professionals alike. And I'd like to introduce you to our presenter, Diana Thompson. Diana is the author of Hands Heal, Communication, Documentation, and Insurance Billing for Manual Therapists, and it's already in its third edition. She's the immediate past president of the Massage Therapy Foundation and is a licensed practitioner in the state of Washington. She began her practice in Iowa in 1979, working exclusively with college athletes, and became licensed in Washington in 1984, where she founded Lakeside Massage, the injury clinic. Diana has taught at dozens of CAM schools throughout the United States, including Bastar Naturopathic University and Seattle Midwifery School. She's presented at state and national massage, physical therapy, chiropractic, and midwifery conventions and seminars, and has been a consultant on several massage research studies, and for regional and national insurance carriers and networks. Her first edition of Hands Heal was published in 1993. Oh, and the fourth edition is due out in 2011. Diana, welcome to the World Massage Conference. Wonderful to have you back.
Thanks, Melanie. It's great to be here.
All right, so let's get started. Let's talk about charting. This is such an important topic.
It's so thrilling. You know, I always wonder if massage therapists really got into this profession just to chart, because there's really nothing more exciting, I think, than charting. And if that were true, you know, I'd be a millionaire. But that's not true. We didn't get into massage just to chart. But I have an idea that if charting could enhance our client relationships, we would all do it. So it's my goal really to spend time with you today to hopefully get you to the point where you can see the value in charting and find the ways to have charting enhance your client relationships. And because I really believe that if we, above and beyond everything else, can document progress as a result of massage And we can reinforce that with our patients if we can help them see the progress that they're gaining out of coming to massage, then they would keep coming back. So that's what we're going to focus on today. So the next slide on why chart. From the patient's perspective, I think it's really important that we think about what the patient is going through when they come to see a massage therapist, often for the first time. I think CAM, or complementary and alternative medicine, of which massage is a part of, is still uncharted territory for the most part. And without this kind of ritual of writing things down and asking health-related questions, people might wonder, really what's going to happen to me when I come for my massage. But charting is something that every healthcare provider does. When you go to see your doctor, she or he might also ask you questions and write things down in your chart, and it just gives it that professional appearance to the session. Makes you look like you know what you're doing as a healthcare provider, and I think it helps the patient feel like they're being heard and what they're telling you is being taken seriously when you write something down. So it becomes their historical record of how they're feeling. It becomes your memory. Oftentimes I'll refer back to the past and say, how are your shin splints that you had at the beginning of the summer? And they'll say, oh my gosh, I forgot I had shin splints. They've been gone for, a month now or 2 months. And then suddenly the value of charting becomes very real. It's also great for safety. I think it helps remind us of the possible contraindications that our patient has. It provides, as I spoke of earlier, of proof of progress. If we can say, oh my gosh, those shin splints are gone, then perhaps it was the massage that really helped those go away, and they're going to choose massage over something else during these economic times where people are having to make decisions about how they're spending their money. It's also great for education for the patient. They get a sense of what it is that we're doing, how we're thinking about their care, what we're choosing to use, and it helps them realize what's working and what's not working, and maybe they'll incorporate some of the things that we're doing in our sessions in between sessions so that they can do some self-care. In the next chart, we talk about the public perception of massage as healthcare. These statistics come from a 2009 AMTA, or American Massage Therapy Association survey. And while we might not always think of massage as healthcare, the public does. And every healthcare provider is required to chart their sessions. It would be really out of character for a healthcare provider not to chart. When we go to see our doctor, for example, for our annual checkup, if everything is normal and fine, the doctor's not going to say, I guess I don't have to chart this session because really you're pretty healthy. No, they're going to chart everything and really show what those baseline healthy measurements are, whether it's your blood pressure or pulse or any blood work that gets done. So it's as important for us to chart healthy people as it is for us to chart those people that have illnesses or conditions. So anyway, I was astounded with this statistic. 96% of consumers agree that massage therapy is a part or should be a part of healthcare. And 76% of us receive referrals from healthcare providers. That's a huge number. 34% of U.S. citizens received massage in the past 5 years. I'm sorry we don't have Canadian statistics to go along with that. And 63% of those 34% received massage for health-related or stress-related conditions. On the next slide, why chart, the healthcare team, we have to think of ourselves as a part of the healthcare team. I think any time we can communicate with other members of the healthcare team, we're going to be providing better care to our patients. And really, it's not our patients that go back to their other members of their health care team and tell them how great we were. It's what we write down in our charts or what we write in our reports and send to them that really impacts our relationship and our status on the healthcare team. So it's an integral part of communication with the other members of the healthcare team, and we can educate them about massage so that they know when to refer to us. And again, safety, I think, is another important issue. They may have things on their charts that we don't. We might have things on our charts that they don't. So sharing information that way really ensures safety as well as continuity of care. I think one thing we don't think about in terms of responsibility and liability is that when a physician refers someone to us, they are liable for the care that we give. So if we're not communicating back to them, they're going to be hard-pressed to refer us more patients because they don't know if we're really providing the care that they're asking for or providing safe care or, what we're doing at all. So for them to take full legal responsibility by referring to us, it's the least we could do would be to communicate back to them. And I had one doctor tell me one time that he would refer more to massage therapy if we could demonstrate that we kept soap charts for the past 6 months on every patient we'd ever seen, and that then he would be comfortable sending referrals to massage therapy. So really it's our ticket into really steady stream of referrals from other healthcare providers. From the legal or insurance issue, we can't get paid without our charts. There has to be some proof of service that we provide. We also have to prove medical necessity, which is really about demonstrating that the patient has the condition that they say they do or that they're getting referred to massage for. So we need to back up their medical condition with the findings that we might report in a SOAP chart. We also have to be safe and economical. Massage therapy must be, if they're going to keep covering massage therapy. Anytime massage is reported as being less invasive and more economical than something else like a surgery, for example, they're more apt to reimburse for that service. So it will help us in the long run to chart. And it will also help avoid malpractice claims. There have been several situations where I've been called in as an expert and somebody was claiming malpractice, and the problem was that the massage therapist didn't chart the session, so they couldn't even prove that they didn't have a malpractice case in front of them. They couldn't demonstrate that what they did was safe or effective because there was nothing that they could refer to. So the only way to avoid a malpractice claim is to have good records. So all that said, I think it's always good to create some motivation for charting before we actually get into charting. But there are several styles of charting that are available. SOAP is probably the most popular. It's subjective objective assessment plan. Functional outcomes reporting is a newer style of reporting, and actually I like to combine the two. I do functional outcomes reporting in the A section of the SOAP chart. Narrative charting is just writing in paragraph form. You just write stream of consciousness as things come to you. That's great if you don't have a lot to say, but if you really have someone where you've got some either complicated condition or quite a few things that you're trying or findings that you're recording, I think information gets lost in a narrative style report. I prefer SOAP charting because I like to jump around a little bit in my conversations with my patients and how I'm applying the care that I'm giving. And if I have categories, I can go back and forth to each category. I don't have to have any other sort of method of organization. I can do my work as I do my work and plug it in as the categories are available to me. So I much prefer that style of that format of organization to a narrative chart. But narrative charting is fine and perfectly acceptable. Wellness charting is something completely different from SOAP charting, and I want to get into that next. So the next slide is about how you decide when you're going to do wellness charting and when you're going to do a medical record like you would do with SOAP charting. Wellness charting is really for those situations where the patient or the client doesn't have an injury or an illness or a medical condition, or if they do, that they're not seeking massage to ameliorate those conditions. It's not a curative session for them. They're just really there to get some relaxation, which in many respects is a form of treatment, but if it's more general, then a wellness chart really is fine. If someone's very healthy, you're not going to have a lot of symptoms to record. You're not going to do a lot of measurement tests like range of motion testing or postural assessment or anything like that, because you're really not going to find things to write down. So why do a SOAP chart and make things up or exaggerate things just to fit them into categories? You might have felt like you were doing that in massage school if you were asked to SOAP chart someone and they were really perfectly fine. So we want to create a different kind of charting for those people who don't have medical conditions or aren't seeking relief from their conditions, and really they're there for a much more general reason. On the next chart, or on the next slide, this is what's really required. If we're just going to chart wellness care and we don't have a lot of symptoms to record, we still need to take a health history. This is really where we can ensure the safety of the patient or client. We need enough information to know that they don't have things that are contraindicated. We need to know what their medications are that they're taking, so we have some way of monitoring their response to the massage, and knowing that what we're doing is really going to help them instead of make them worse. And we also need to record the care that we provide. So whatever type of massage you do, where you do it, for how long, those are the most important parts of a SOAP chart. And unfortunately, that's for litigation purposes, but I like to think of it as also being for the client's sake as well, so that I can remember them when they do come back. Even if they're coming in for wellness massage, they still might come in every month or twice a month. And it's good for me to have a running history of what we've done together. So health history and the treatment frequency and duration and location are the things that you absolutely need on a wellness chart. Anything else that helps you with the continuity of care for the future, you can also write down. It doesn't limit you from adding things to it. That's just what's minimally required. And I put an example on here for you. Full body relaxation techniques, 60 minutes, no health conditions addressed. So your chart notation could be as simple as this. On the next slide, when you're charting within a healthcare system, there are certain things that absolutely need to be documented. And one of those things is reasonable and necessary care. So what does that mean? What does reasonable and necessary care mean? One thing that we spoke about earlier is substantiating the medical condition. So we need to know that the care was necessary. So do they have a medical condition that necessitates massage therapy as a treatment? And then, is it reasonable? Is massage therapy a reasonable treatment modality that you would use for this particular medical condition? And that's where you demonstrate the progress as a result of the massage therapy services that you provide. So those two things are absolutely critical for record in a healthcare system. To do those things, we're going to use intake forms. We're going to use standard medical record keeping formats like a SOAP chart. I think another one that has gotten some good press these days with Mary Kathleen Rose is called care charting, C-A-R-E. And it's very similar to SOAP in its content, but it's got, just a really nice acronym, and she's got some really nice descriptive sections for that. So if SOAP charting is a little too clinical for you, you might look up care charting with Mary Kathleen Rose. So the standard medical record keeping formats, measurement tools, and it's good to chart and graph progress. So we're going to do a lot of that in the examples today. Measurement tools could be anything from how you record your range of motion testing, the grids or plumb lines that you might use for postural assessment, could even just be the 0 to 10 scale, but we're going to go through several of those measurement tools in a minute. I thought I'd throw this in. This is just verification for insurance billing. Some of you might be billing insurance companies, in which case there are some questions that are very important to ask. This is not a webinar on insurance billing, but I always think it's worth it to stick this in there. So these are the questions that you would need to ask to verify that insurance coverage is available for the patient that you've got in front of you. And this would help you take that risk of billing their insurance instead of taking cash up front. So the first thing that you need to find out is the diagnosis that you're seeing this patient for, or the ICD-9 code, which is a diagnostic code, a covered illness. So it might be that they're coming to see you for fibromyalgia, but that their insurance doesn't cover fibromyalgia or cancer for that. For another example. So make sure that whatever it is that you're seeing them for actually is a covered illness under their insurance plan. Then you want to make sure that they have physical medicine or rehabilitation as a covered service under their plan, because massage therapy is classified under this section in the CPT code book. Then you want to find out if a massage therapist, whether you're a licensed massage therapist, licensed massage practitioner, or whatever your regulatory status is, can provide that physical medicine and rehab. Sometimes the insurance company will offer that service, but it has to be performed by a nurse or a chiropractor or a physician. So you want to make sure that you as a massage therapist can provide that service. Then you want to check and make sure which CPT codes are allowed for massage therapy services. So the CPT codes are, there's a code for Swedish massage, there's a code for myofascial release. So there's several different codes that are available, and you want to find out which ones are allowed under their plan. And you want to know what the restrictions are on those CPT code services. So, for example, it might be that they only get 12 sessions a year, or you could only bill for 2 units instead of 4 units, or that some of those codes are reimbursable under some conditions, but not every condition. So it's good to know all of those things before you take on the burden of delaying payment by billing insurance. All right, let's get into SOAP charting. So the definition of SOAP is Subjective Objective Assessment Plan. And in the subjective section of the SOAP chart, it's all the data that you would gather from the patient. So what are their goals for the session? And I like to prioritize those, because if they have 3 or 4 when they're coming in, and you maybe accomplish 2 or 3 of them, but the most important one to them they leave with, they're not going to think fondly of their massage session. So I always want to know not only why are they here and what can I do for them, but to prioritize those lists, those concerns. Also under the subjective section are their symptoms. And so you want to figure out how they're feeling, what's bothering them relating to the condition that they're seeing you for. and their activities of daily living. So that's what ADL stands for, activities of daily living, that both aggravate and relieve the condition. So I want to know what makes it worse, but I also want to know what makes it better so that I can help them create the self-care plan that's going to work for them. On the next slide, we've got the objective section of the SOAP chart, and this is all the data from the practitioner. So all the visual and palpable and movement findings that you might be gathering as you assess the patient. It's all the treatment that you provide, what you did, where you did it, and why, and it's the patient's response to the treatment. So all three of those things are included in the objective section of the SOAP chart. The assessment section is typically for diagnosis, but because the majority of massage therapists in the United States and Canada cannot diagnose, it's good for us to really look at how can we use this section to the best of our abilities, and functional outcomes is a great way to do that. So we'll get into those in a minute. The plan section is all about future care. So it's what you want to recommend for the next session or series of sessions. And it's what you want to suggest that the patient do in between sessions. Any sort of homework or self-care, stretching exercises, self-massage exercises, icing, that kind of thing. There are 4 different types of SOAP charts. I think it's important to go through these because it can be very intimidating to think about collecting all that information every single time you see a patient, and that's not really necessary. You really should be doing an extensive information gathering once a month or once every 6 to 8 sessions even. So that initial session, you want to gather everything you can about how they're feeling, how it's affecting their condition, how it's affecting their activities of daily living, everything. But then in those subsequent notes, in between the initial evaluation and the reevaluation, you're really only going to chart things that seem important on that day and the treatment provided. So if you just wrote down the treatment that you gave in those subsequent sessions, that would be adequate for a SOAP chart. It's really on those evaluation sessions where you're going to gather the range of motion information, the posture, the palpation findings, and note progress. Now, if you don't do the evaluation sessions, of course, that amount of charting, just the treatment that you provided, isn't adequate enough. So make sure you've got those good evaluation sessions in between, or periodically, every 6 to 8 sessions. A discharge note is a little bit different because you're going to write down a plan for them that they'll pursue without you. So this is really about wrapping up a case, saying that they've met the goals that they've set forth and that they're managing their condition quite well without you. It doesn't always mean that they're never coming back. They might be coming back on their own once a month for maintenance, or if there's an exacerbation of the condition, of course, you'll see them again. But it's good to really celebrate the accomplishment and send them off with some homework that helps them take care of themselves without you. So it's a good mark in their progress. There are particular guidelines for charting that I just want to go through with you quickly, and then we'll get into some of the meat of the things. So the most important part of your relationship with your client is that you're practicing good listening skills. Be attentive to your patient, listen clearly. If you're writing things down and they're having some emotional response, really set down the pen and look your patient in the eye and really be available for them. So don't negate good listening skills because you have to chart. So when you are charting, record information as clearly and concisely as possible. You can really leave out a lot of the story and just get right down to it. Measure everything that you write down. If it's worth writing down, it's worth measuring. That's something that I really can't say enough. You should have this be your mantra as you go to sleep tonight. Measure everything, measure everything, measure everything. If you say one day that they have a headache, but you don't say how bad it is, then when they come back in the next week and they say they have a headache, and they come back in the next week and they say they have a headache, and they come back in the next week and they say they have a headache, you're going to start pulling your hair out and think, oh my gosh, what am I doing wrong here? They still have this headache. There isn't anything that I'm doing that's making any bit of difference at all. When that might not be the case at all. It might be that they have a headache the first time they come in, and it's so severe that they had to leave work that day. They really couldn't concentrate, and it feels like their whole head is pounding. And then the next time they come in and they have a headache, maybe it's really only moderate, that it only started the day before. It hasn't been this all day, every day kind of headache, and they were able to work through it, but it is a little disrupting. And then the third time they come in, it might be that they have a very mild headache, that it's not interrupting their work in any way, and that it only started that afternoon. And so they thought, well, I'm coming in for my massage, that's perfect. So in both cases are exactly the same, except one, you're celebrating your successes, and the other, you're ready to start selling Amway instead of doing massage. So the more you can measure how they come in, so the duration, the frequency, the severity of their symptoms, the more you're going to be able to show progress over time. You want to be specific and avoid vague statements. For example, you never want to say they're better, because better can mean that they no longer need care to an insurance company, whereas to you it might just mean they went from a severe headache to a moderate headache. So it's better just to measure the symptom than to say they're better. You want to use consistent terminology and common medical terms and standard abbreviations. So if in your measurements you say something is pretty bad, or they're kind of sore, or they're moderately painful, or you say they're 7 out of 10 on a pain scale, if you're all over the map, it's going to be pretty hard to compare apples to oranges. So the more consistent you are with the terms that you use, the better chance you have of demonstrating progress. On the next slide, there's a few more guidelines. So be objective. Try not to make assumptions in your charts. You would never say something like, patient has back pain, but they really just don't want to go to work. So you'd never want to assume that you're mind reading or understanding what's underneath their motivation for pain or whatever. You really just report the facts. So be objective. Record positive and negative findings. So that's like the example that I gave with the physician. A negative finding really means that they're fine. A positive finding would be that they tested positive for pain with a trigger point. So they said, ouch. But the negative finding is you're pressing on this old trigger point that used to be there, but it's no longer painful. So you want to say no pain. So report those negative findings as well as the positive findings. We need to know when we can check things off the list and that things are getting better. Some things we don't often think about, but really you want to sign or initial and date every entry. And you sign your legal name, not your nicknames. So really that's kind of the mark of every entry. If anything ever goes to court, they're going to look for your signatures and dates to know where each entry stands in the timeline. If you're a teacher and your students are documenting their sessions, then you need to co-sign those documents, because you are legally responsible for every session that your student gives, or your aides or apprentices or anything like that. The other thing that just is really important to remember about your SOAP charts is that you should print or stamp your name, address, and phone number on every single page that's in a patient's chart. If you make copies and send things out to an attorney or to an insurance company and they get lost or mixed up from the rest of the chart, if your name's not on there, typically they'll fax them over to me because my name is sometimes at the bottom of those SOAP charts with the little copyright symbol. So every month I get a fax from an insurance company saying, can you let me know which patient this is? I've lost track of which file this belongs with, and I have to tell them that it's not my patient, that I created the chart, but not the chart notes themselves, and they file it away in the never to be paid file. So if you really want to get paid, that's one of the simple things that you can do. Okay, some interview questions. How do we get the ball rolling in terms of gathering information? What's the way that we can most acknowledge our patient's condition and not ask such probing questions that we limit the information that we could get? So I thought I'd write a few down for you. So regarding goals for sessions, it's always good to know, why are you here? What do you hope to accomplish in this session or series of sessions? For health history, what old injuries, surgeries, or illnesses should I be aware of that may influence how you feel now? And always inquire regarding allergies and medications. On the next slide, around symptoms, what should I know about you today in order to tailor this session to meet your needs and ensure your comfort? Regarding activities of daily living, what are you doing when you notice your pain, and what works to make your pain go away? And then, just to find out what they like or don't like about massage from their past experiences, what do you like or dislike about massage sessions? You want to make sure that you're really listening to what the patient says and that you're going to tailor the session really to meet their needs. That you're not just asking these questions and then you're going to do whatever it is you were going to do anyway. So, types of evaluation. This is we're getting into those measurement tools that are so exciting, because I think we can ask a lot of those questions and write a lot of things down, but if we've got some good measurement tools, then we're really going to collect the information that's most important. So let's go through a few of these. To gather subjective information, we're going to look at functional outcomes and perhaps these following measurement tools. So the visual analog scale is one. That's the VAS, or the functional rating index. There's also some disability indices that we're going to look at. I think it's always helpful to have figures for patients to draw symptoms on. Some people write well, some people talk well, some people draw well. So you want to make sure you're getting all the different learning styles of our patients. For objective evaluation, we're going to have some measurement tools regarding posture and range of motion and swelling. We can also use a verbal pain scale. I think photographs say a lot. So anytime you can do a postural analysis with the patient standing in front of one of those grids with a plumb line in front of them, really you're going to get just a ton of information that you can keep referring back to, and it really makes an impression on the patients. I think I still have my photos from my very first Rolfing series that I went through. Range of motion can be charted on a star chart. That's one way to do it. There are other forms of documenting range of motion as well. I think, of course, if we do the measure everything thought process with range of motion, we want to make sure that we're getting the quantity of range of motion as well as the quality of range of motion. And if you're using degrees, you should be using a goniometer, something that will really give you very specific degrees of range of motion. If you're eyeballing it, I would stay far, far away from degrees. Your charts might be compared with someone who is using a goniometer, and you don't want to have that moment where you're getting compared to another healthcare provider who might have a higher status, more education, more weight with their professional degrees. And then once again, the massage therapist is looked down upon. So please don't use degrees unless you're using a goniometer. So mild, moderate, and severe is fine when rating your quantity of range of motion. With quality, it's as much about how smooth the motion is as how much the range of motion is. So quality is a great thing to add into your measurements of range of motion. With a tape measure, sometimes I don't think we always think about what's available to us, but there are some pretty handy things that most of us already have in our junk drawer that we could pull out and use for measuring the amount of swelling. If someone has swelling in their ankles or in their knees, it's great just to pull out a tape measure. A cloth tape measure, not one of the metal ones, and see what's going on there. When we look at the visual analog scale, it'll be a 0 to 10 scale, but we can also do it verbally, and I'll show you those in a minute. So I've talked a few times now about functional outcomes, and I'm not sure everyone really knows what those are, so let's go through these. A functional outcome is our ability to say that someone's gained progress in relationship to a specific activity. And functional outcomes always start with SMART goals. So SMART stands for specific, measurable, attainable, relevant, and time-bound. So it's not enough just to say that sitting is causing pain or standing, but let's talk about the activity that goes along with it. So sitting at their computer, or standing at their workstation, or walking around the block, or whatever it is. Let's attach it to an activity so that people have some sense of what to go back to when they're comparing their progress. We want to measure, quantify, and qualify everything we can. We want to make sure that we're setting goals that the patient can attain. It should be relevant to their activities of daily living. We're not going to set a goal around swimming if they don't swim, or driving if they don't drive. We want to make sure we're picking activities that they do on a regular basis throughout their day. And we want to make sure that it's grounded in time. So there are such things as short-term goals and long-term goals. So short-term goals are typically accomplished in a week or two. Long-term goals are more like 4 to 6 weeks when we're setting something and asking them to accomplish it. So I've got a couple of examples on the next slide of SMART goals. So a long-term goal could be that the patient will be able to sit at their computer for 60 minutes, 5 days per week, with no more than mild pain in her neck within 6 weeks. So sitting at the computer is the specific activity of daily living. We've measured it by saying for 60 minutes and 5 days a week. And we've quantified the pain by saying no more than mild pain in her neck. We don't know the patient, so we're not quite sure if this is attainable for them. You know, it really depends on what they're able to do right now. So you'll have to trust me on that one and its relevancy as well. We would assume that this person sits at a computer for their work. And we've set it in time by saying that they're going to accomplish this goal within 6 weeks. A short-term goal, something that will lead us up to this, might be that the patient will be able to sit at the computer for 30 minutes, 3 of 5 days per week, with no more than moderate pain in their neck within 2 weeks. So the outcome, of course, would be the patient can sit at the computer for 60 minutes, 5 days a week, with no more than mild pain in her neck. So those are things that we could do with almost any activity that they have. I wouldn't do more than one at a time, so pick an activity that seems to be most important for them. Your habit is going to be to start saying, well, they can sit for 60 minutes, but if they get up and they take a break and walk around the room or do some stretches, they'll be able to sit for another 60, and absolutely, those belong in your treatment plan. But as part of the functional goal, we'll just keep it really clean and just talk about the activity and how we can measure whether or not they're able to perform that activity. So here are some other tools that we can use. This is the visual analog scale. You can see I've cut it out of my health report, which you can find on the broadcast page of this website. So you can draw on those pictures of which we can only see the feet of. But below those feet are visual analog scales. And in particular, it's a line of continuum with no numbers associated with it. So really, we're just looking at the extremes of pain and function. So no pain at one end of the scale, unbearable pain at the other, or unable to do any activities versus they can do anything they want. So they would make a mark on this line, and unbeknownst to them, this line is 10 centimeters long. So you can measure where they make their mark and record a number. So it might be that where they make a mark is 7.5 on the 0 to 10 scale. So that's what you would record, but they're just making a mark on this unmarked line, this line of continuum, and that's the most accurate way. It's the most reproducible, the most reliable in terms of how research has substantiated the use of a visual analog scale. So I think it's kind of handy. So I like to use it, and I use this about every 6 to 8 sessions. So when I do my reevaluation session. Another example of a measurement tool is the functional rating index. This again is on the broadcast page. I just cut out a few examples on this slide so you can see this is another example of a line of continuum, but it is marked by numbers and by words. So it really helps people decide what number most expresses their pain. Just another way of using that 0 to 10 scale, or in this case a 0 to 4 scale. On the next slide is a patient-specific functional scale, or functional and pain scale. This is something that I've become fond of lately. It's a new form for me. It's a combination kind of that functional rating index and a disability index, which we'll talk about later. So this is very patient-specific in that they get to pick the activities, whereas on a lot of these things, like the functional rating index you just saw, it picks the activities for you, and you rate on all 10 of them. Well, this one, it's just asking for you to pick 3 activities that you are unable to perform or having difficulty performing, and write down those activities and then score them. And then you date them over time, so maybe every 6 to 8 sessions. You would pull this form out, and they would score it once again, and they'd be able to see what their progress is over time. So it's a nicely adaptable form. The disability indices, there's a couple that I use a lot. The Vernon-Meyer is a neck pain disability index, and the Oswestry is a back pain index. They're also on your broadcast page. And again, these are, 10 different activities that you would then rate. And really here you're just checking a box. So there's no line of continuum. There's no 0 to 10 or 0 to 4. It's check the box which best describes how you're doing. And then each of those boxes is assigned a value from 0 to 6, 0 to 5, and you can add those up and multiply by 2, and then you get a percentage index of over 100%. So if you checked whatever boxes and came up with 36, you'd multiply that by 2. That would be 72, and then you would be able to say I have a 72% disability. So it's kind of an interesting way to do that. These I would not use for people who have any type of learning disability. They're quite text-dense, but some people who really like to be specific about exactly how they're feeling love a form like this. So again, something you would fill out every 6 to 8 sessions. Then, once you get all this information and you want to graph it, it's really easy to do. And I think we should be graphing things more than we are, especially if you're going to write a case report or send in a report to a referring physician or an insurance company. It's really nice to be able to chart the progress. So on a 0 to 10 scale, we've got the 0 to 10, up the axis on the left, and then the dates across the horizontal line. And then you just make a dot at the point of the referring 0 to 10 that they rated on the date that they rated it, and then you can attach a line and kind of see the graph. This also works for the functional rating index if you were to do the 0 to 40. So there are 10 questions. The highest you can get on a functional rating index, if you circled the 4 on every single one of those 10, would be 40. So charting the progress would be a function of just noting that number between 0 and 40 on the one axis, and then the dates across the other. With the disability indices, it would be the 0 to 100. So it would be the percentage of disability that you could rate and graph. So I think it's just a nice thing to have that we could graph these things. On the next slide, we've got communication with the healthcare team. So I've been referring to reports on occasion. So I just want to give you the lowdown on what kind of reports are expected when you're working as a part of a healthcare team. Progress reports should be sent every time you do an evaluation session. So there's the initial progress report that you would send after the first visit. Just kind of give them the lowdown on what you found and what your first functional goal might be. So what is it you hope to accomplish in the series of sessions that are coming up? With the progress reports, you're going to request additional care, perhaps. You might be asking for another prescription. You've done the first 6 massages from the first prescription. They'll want to know why they should write a report or why they should write a new prescription for another set of 6 massages, for example. So you'll want to let them know the progress that you've attained so far. So give them the lowdown a little bit on the symptoms that have gotten better or gone away, and then the functional goals that you've been able to accomplish. But then you'll also want to say, this is what we still have yet to accomplish. We want to reduce these symptoms. We want to gain this functional outcome, and this is how you might do it. So give them your treatment plan as well. What techniques might you use to accomplish those goals? And send that off. It shouldn't really be more than a couple of paragraphs. It should be a report that takes you 10 minutes, perhaps, to type up. All the information should be found in your SOAP chart, so it's not like you're drawing from memory for the information. You're just looking through the charts to collect the information and put it into a narrative letter format and send that off. Again, the physicians are really going to appreciate a progress report. Everyone else who's a part of the healthcare team sends them. For example, if they send someone out for an MRI but never got a report back from the person who reads those MRIs, then how would they know how to proceed with that person's care? So we need to be thinking of ourselves as an integral part of the healthcare team and communicating as such. Narrative reports are really not something that I would do for free. So progress reports, you're going to just be expected to write those to members of the healthcare team, but a narrative report typically is done with an insurance claim, for example, a motor vehicle case. This can keep you out of the courtroom. I've had to do expert witness testimony before for car accidents. The better my chart notes are, the less I get required to go and testify in court. And if I can avoid that, I will. So a good narrative report is in order. I would charge about as much as you do per session, or 2 or 3 sessions, probably no more than that. You never want to charge more than the doctors charge for their narrative reports because you don't have a diagnostic scope. So you're not going to be able to provide as much information as they can. But it really is one of those compare and contrast reports. If you can remember from school how we used to have to do compare and contrast papers. So you're letting people know how the patient was when they came to see you at first, how they are now, and what transpired in between times. A discharge report is very similar to a discharge SOAP chart. You're just letting the physician know that they have reached the goals that you have set with each other, and that you've given them an extensive self-care routine and are sending them back to the healthcare provider. So you don't ever just discharge them on your own. You always discharge them, sending them back to the referring care provider if it came as a referral. So they're the ones that truly discharge the patient from your care. So just in summary, I just want to say please, please, please chart every single session, even those chair massages that you perform at events. As healthcare providers, we are required to write something down, even if it's just what care you provided. It can be that simple. And use the records to better serve your patients. This is their memory. This is their medical record. This will help them see how much better they are as a result of your services. Measure everything, measure everything, measure everything, and communicate regularly with the healthcare team. This will ensure our place at the table with integrative medicine, and will make sure you have a steady stream of patients to work with. So that's all I have. I would love to have some questions from people.
Diana, thank you. That was amazing. That was so thorough and so easy to follow and learn, and gave us so many reasons to do that. Our time is really tight, so I know Kevin has a couple of questions for you, and
okay.
I know you're also going to be in the chat room live. But just quickly let us know where we can get a hold of you in case people have questions that didn't get answered.
My email address is soapsage. That's where that name came from. SOAPSAGE @comcast.net.
Perfect. Hi, Kevin. You got
Hello.
2 quick rapid-fire questions for Diana for us?
Yes. Well, because we're short on time, I'm just going to quickly summarize some of the questions that were being fielded. And probably the number one question was, where can we find these charts and examples of reports that you're talking about? Where could they find that resource online or in a bookstore or wherever?
Yeah, the book that I wrote, Hands Heal, Communication, Documentation, and Insurance Billing for Manual Therapists, has all the charts in it. The patient-specific form is actually in the 4th edition, which is coming out next year. So that one's not available in my book yet, but will be in the next book. And the functional rating index, the Oswestry, the Vernon-Meyer, you could also Google those and find them. I know the FRI has a website, and you just you sign an agreement on how you're going to use the form, and then you can access it. So you can get them the same way that I got them, which is just online.
Excellent. No, that's great. There is a lot of online resources that we can find. It's just a matter of picking the ones that work best for us.
Yeah, and I'm hoping I did that for you, that I really looked at a ton of different measurement tools, and these are the ones that I think are the easiest and have the best reliability.
Perfect. The next question was about technology and using technology for recording. You touched on it a little bit with the photos of the postural assessment. What sort of are other acceptable uses of technology in terms of recording our patient notes?
My favorite software system for charting is WinCity, WINCITY, WinCity Soap Notes. It's the most detailed system. There are several systems out there, but mostly they're just narrative, or they'll just give the SOAP sections, and you type in whatever it is you want. But with WinCity, it remembers your chart from session to session, and it also has scroll-down menus, pull-down menus. It's got figures. You can click and drag different notations onto those figures for scars, for trigger points, for adhesions. So it's it's a system that creates every option you might need or you can put in and customize it for you. So it's really an amazing software system for soap charting.
Excellent. Well, thank you very much. I'm going to hand it back over to Melanie. And if anybody has any other questions, please feel free to contact Diana.
Thanks.
Great. Thanks very much, Kevin. And Diana, again, thank you so much for bringing us through, again, a very important piece of what it is we do as therapists. I love how you talk about, the value or really getting the clients and patients to understand the value of their treatments by charting, something very simple. And when we can demonstrate that, that's a wonderful way for client retention to happen as well.
Yes.
So again, we don't necessarily always think about those things. So I want to just say thanks again so very much to our sponsors, our global sponsor, Massage Envy. And Massage Envy offers steady client flow, competitive wages and benefits, full and part-time positions, and a respectful, positive working environment. To apply for a position near you in the United States, visit massageenvycareers.com. Thanks again so much to our daily sponsors, Massage Today, Massage Warehouse, the Upledger Institute, Massage Magazine, and BioFreeze. And just remember that all of these presentations for the 2010 season, the entire spring and fall season with pre-conferences, that'll all be available until April 30th, 2011. And we invite all of our registrants to download all of the audio presentations to create a resource library for yourself and print out handouts and PDFs. And Diana has handouts and PDFs on her page as well, so make sure you're printing those out. And if you're in the United States and you require NCB TMB credits, make sure that you click on the information link there, and that will tell you how to access those. On behalf of my World Massage Conference partners, Eric Brown, Scott Dartnall, and our special guest host today, Kevin Cunningham, and our very, very special guest, Diana Thompson, I want to really thank everyone. And Diana's going to pop into the chat room on this live event. So thanks again, Diana. We really appreciate it.
Thank you, Melanie. It's great to be here.